Hello medicos, welcome to our channel BackbenchersMed. This is our second part of anterior uveitis. In the first part we had learned about the definitions, the signs and the symptoms. In this part we are going to learn about the complications, the causes and the treatment. So let's start. The most common complication is complicated cataract, and the most common complication in recurrent cases is secondary angle closure glaucoma, and the most common cause of visual loss due to posterior involvement in anterior uveitis is cystoid macular edema. So now let's see how secondary angle closure glaucoma occurs in recurrent cases. So let's track back and see, as we have seen in the previous video in the pupillary signs, that in recurrent cases there is annular ring synechiae formation, and due to that their pupil is completely in adhesion with the lens, and hence aqueous is not able to flow from the posterior chamber to the anterior chamber, and hence the IOP increases, and this causes secondary angle closure glaucoma. So as you see, the most common complication in recurrent cases is secondary angle closure glaucoma. So all you need to remember in complications is complicated cataract, secondary angle closure glaucoma, and cystoid macular edema. Two other complications are cyclitic membrane choroiditis and band-shaped keratopathy. So now let's go to the causes or the etiology of anterior uveitis. Now anterior uveitis can again be divided into granulomatous uveitis and non-granulomatous uveitis. So the causes of granulomatous uveitis are very easy. They're basically the granulomatous diseases like TB, leprosy, sarcoidosis, syphilis, herpes. Again, it can be remembered by TLS square. So T stands for TB, L stands for leprosy, S stands for sarcoidosis, and S stands for syphilis. Okay, so the most common type of leprosy where anterior uveitis is seen is lepromatous leprosy, and the sign seen in leprosy is Irish pearls. Okay, in sarcoidosis, the most common ocular manifestation of sarcoidosis is granulomatous anterior uveitis. So it comes as an MCQ. So the most common ocular manifestation of sarcoidosis is granulomatous anterior uveitis. Okay, the most common type of syphilis where anterior uveitis is seen is late congenital syphilis, and the sign in is iris roseolus. Okay, again in herpes, the signs that you see of anterior uveitis are raised IOP, hyphema, stellate cavities, and sectoral iris atrophy. Okay, now let's go to the non-granulomatous uveitis causes. In acute, we have the most common cause is idiopathic. The next cause is HLA-B27 associated diseases like ankylosing spondylitis. Okay, what do you see in ankylosing spondylitis is lower back pain, stiffness, and unilateral anterior uveitis. Next, we have Behçet's disease. What we see in Behçet's disease is bilateral recurrent anterior uveitis, cold mobile hypopyon, and aphthous mouth ulcer. Behçet's disease can be remembered by the mnemonic BAH. Okay, BAH. B stands for bilateral recurrent uveitis, A stands for aphthous mouth ulcer, and H stands for hypopyon. Okay, now next cause is IBD, which is inflammatory bowel disease. Okay, and next cause is drug-induced uveitis. So the drugs which causes uveitis can be remembered by CML. Okay, CML is a type of leukemia, so you can use this to remember the drugs. Okay, C stands for cidofovir, M stands for metoprolol, L stands for latanoprost, and one extra is pilocarpine. So CML, please. Okay, CML is a type of leukemia, and please. So cidofovir, metoprolol, latanoprost, pilocarpine. Okay, now the chronic causes. The chronic causes are juvenile idiopathic arthritis, Fuchs heterochromic iridocyclitis. The clinical features of Fuchs heterochromic iridocyclitis are no posterior synechiae, floaters, unilateral, and cataract and heterochromia iridis, and stellate keratic precipitates. It can be remembered by no FUCHS, no Fuchs. Okay, so it's no posterior synechiae, floaters, only symptoms, and unilateral, cataract, heterochromia iridis, and stellate keratic precipitates. Okay, so let's summarize the causes. The causes are granulomatous and non-granulomatous causes. Okay, So granulomas can be remembered by TLS squared, TB, leprosy, sarcoidosis, syphilis, and herpes. The non-granulomatous uveitis causes can be divided into acute and chronic. The acute causes are idiopathic, HLA-B27 associated diseases, Behçet's disease. Behçet's disease can be remembered by BAH and IBD. And drug-induced uveitis. Drug-induced uveitis can be remembered by CML, please. Okay. And then the juvenile idiopathic arthritis is there, and then the fuchsious heterochromic iridocyclitis, which can be remembered by no fitches. Okay. Now let's come to the treatment of anterior uveitis. The treatment can be remembered by an easy mnemonic: ACSIN. Okay. Here A stands for antimetabolites. Okay. C stands for cycloplegics. S stands for steroids. I stands for immunosuppressive drugs. And N stands for NSAIDs. Okay. The steroids are prednisolone and difluprednate. We need to taper the doses at the end to reduce inflammation by the anti-inflammatory effect. So why steroids are used? To reduce inflammation. Okay, as simple as that. And the cycloplegics use are atropine. It relaxes the ciliary muscle to relieve pain, breaks any posterior seneca formation, prevents formation of posterior seneca by keeping the pupil mobile. So cycloplegics can help to reduce glaucoma, which is the most common complication. Okay. And in antimetabolites, if inflammations and recurrent episodes require longer term steroids, antimetabolites can be used. Okay. And the common side effect of steroids are of topical is glaucoma and systemic is cataract. So we need to keep in mind the doses so the side effects does not occur. And next, the drugs are NSAIDs and immunosuppressive drugs. Okay, the indications of immunosuppressive drugs are severe cases of Behçet's disease, pars planitis, etc. Okay, and last is azithromycin or tetracycline or erythromycin. These are antibiotics. So in ophthalmology, we give antibiotics in almost any disease. So azithromycin or tetracycline or erythromycin need to be remembered. So let's revise. ACSIN. A stands for antimetabolites and azithromycin. C stands for cycloplegics like atropine. F stands for steroids. I stands for immunosuppressive drugs, and N stands for NSAIDs. Now let's go to the physical measures. The physical measures are hot fomentation and dark goggles. Hot fomentation produces soothing effect and dark goggles. For more such videos, subscribe to our channel, and for the notes you can subscribe to our or join our Telegram channel. Thank you. The link is given below.